This is a crazy, great panel, and I'm going to give a little bit of their introduction before the senator comes in. Here's how we're going to do it. Senator Klobuchar is going to speak, then we're going to have this panel, then we're having a congressman who is coming, and of course we cannot and they cannot completely control their timing. So I want to brag about my friends up here for a moment. Do we have everybody who is going to be on this panel up here? Is Laurie here to American Heart? Oh, there you are. I was like, I thought I saw you. I could have caught the moment where you went out to get some water. So this panel is the one I've said this about every panel, but this is the one we need to listen to so carefully. And I'm going to do some introductions before the senator comes in. You're going to remember those introductions because they're going to speak after she speaks. One of my favorite new people in this whole mix, who I met thanks to George. We keep mentioning George, his name. He may have just walked out of the room. But it was after the UN meetings, and Sans was kind enough to host an event or cocktails there after the UN Brain Health Day. And I met her and knew immediately that we needed to do some things together. Sans has such an interesting background and is so critical at this moment. She actually worked on the Human Genome Project. She doesn't look old enough to have done that, but she did. And she's cool in many ways, but one of the coolest things she's doing right now at Tower Capital is literally bringing billions of dollars to the forefront so that we can focus on generational health and brain health and longevity. And she's doing it in a completely collaborative model. So I'm not going to steal her thunder other than to say, I can't wait to work together. I am so deeply grateful for how you have reimagined how funding can happen. So how you have just garnered this wide swath of both for-profit and nonprofit, I get you, to bring all your superpowers to this. So I can't wait to hear from you. And as we talk about investing in what we're doing, and our good friend Eric Bennett here, who's also starting a brain health fund. So all of you are trying to invest in brain health. Let's get going here. American Heart Association, you know what, you guys are the best. Dr. Elkine has been such a champion. This is the first time I have a chance. And Adi, are you still there? Can you, the clicker's over here. I want to just move people's pictures forward. Thank you, Wes. What's so fun, and I often have Mitch kicking these things off, and why is the American Heart Association kicking off the brain health meeting? Well, because the body is connected and because it's critical. And these guys are now not only do they have food as medicine programs, but are starting a whole brain health division and funding. So I'm not going to steal their thunder either, but thank you guys so much. Michael is here, and we met Michael through our new friend at Google, through Ryan, who said, you're focusing on the kids too, right? And the answer was yes. This is birth to death. I think one of the things that I'm so proud of in this organization is it really has been the entire spectrum of not only who's represented, the work that we do, even all the ideas that the youth entrepreneurs are coming up with have affected literally every age range. So thank you. I'm looking forward to you addressing brain health as it relates to our younger children. And Dr. Palumbo is one of my favorite people on the planet. And if you don't know him, you should. But he has done stunning work over his career, and still in Alzheimer's, in autism, neuro everything, diseases that have to do with inflammation, which sadly they are all connected. Formerly J&J, and now Chief Medical Officer at BioVie, who I had the great pleasure of working on clinical trials with, long COVID and Parkinson's and Alzheimer's trials. So it's an absolute delight. I actually think because we're doing this, you guys are really talking about your work. It's not as much of a panel. And I speak where you like, but it's kind of nice if you want to come up here because people can actually see you better. Yes, Sans. Up you come. Like I said, I am, of all the people in this room, that is a new friend, and there are many friends out here, some I have known, like Rick, for over 30 years. I know we will be working together, and I am so energized by what you're doing, so let's let everybody know.
Thank you, thank you. So I'm here to tell you about generational health and why it's critical for brain health. And without it, we will not have the cures and diseases and sciences and technologies that scale them. I am the CEO and founder of Tower Capital Group, and we are, I think, the only organization dedicated to developing and funding generational health. I was a student of generational health. It's very appropriate that we were here. It was first studied by the National Academies of Sciences and Engineering in Netherlands. They studied how the multi-generational effect of PTSD and war drove disease and other ailments in the larger population. So as a student, I learned about this and realized that we were unable to activate generational health because neither the science nor technology were there yet. But it's here now. As of 7 years ago, in my work for the last 30 years with colleagues and partners, we have identified the cascades of generational health that are truly multi-generational, affecting up to the 4th generation and beyond. And out of the 28 billion that we've assessed, 43% of those are in brain health. So when we think about investing, which is really difficult, investing in brain health is really difficult. It's high risk. It's not always high reward. There's a high failure rate. At Tower, we've opened the aperture on what brain health means, and we look at it with a multi-generational lens that lets us invest across a different continuum of brain. It lets us look at investment in a multi-dimensional way. So I said I started off as a student of generational health, and then I was a scientist at the Human Genome Project. And we watched as we mapped out the genome, but we also watched as genes jumped around. And at that time, we wondered why. Well, now this field of epigenetics has revealed itself, and we know that brain health is tied to our gut. Brain health is tied to our behaviors. Brain health is tied to what we eat. But it all comes down to some of these multi-generational cascades that we uniquely understand. So in order to do something well, we have to do it differently. So one of the themes today that I've heard is everyone here is looking at brain health from a different lens. And at Tower, we do so through these multi-generational cascades. You mentioned funding. We built 3 organizations. We built an R&D organization so we could prove that these cascades exist. And by the way, they're relevant to women's health, pediatric health. Ultimately, multi-generational effect connects to the brain, but connects to many other categories of disease. So breaking the silo of disease is an opportunity for us to open funding, open collaboration for brain and body. We think of it as a bioresilience, biome relationship. Multi-generational effect allows us to be competitive as societies, more productive, but now can be measured, and that is our sole purpose. To take a very wide lens on generations, and we say, what is measurable, what is multi-generational, and where can we scale it with technology? Like I said, 43% of that is in brain. And I will bet that we'll see much more, we will see improved premiums on our investments, but we will also see lower failure rates as we innovate in science and technology because we think in this way. The second organization we created was a nonprofit because we learned that about 34% of our generational health assets, while performing in revenue, service to society, in maternal health and pediatric health and many other places, we're never going to get private funding. These require societal support, requires government funding, it requires us to work together, and finally, we have a funding platform with the purpose of bringing collaborative partners together. Every one of our funds on our funding staff is a collaboration between multiple entities towards a single layer of generational health. Because we can't do it alone, as everyone here has said, but we have to do it with a little bit more precision. There's a lot of precision science, a big precision strategy. To me, generational health is beyond the strategies and methodology to improve how we co-invest, how we collaborate, and how we innovate for the brain. And I very much look forward to working with all of you to do it differently, do it smarter, do it better, and bring more capital to this really important area of work. Thank you so much.
So I do want to, would you guys like to speak from there or from here? Okay, perfect. So this is so fun because I said this is my first time meeting both Mark and Laurie from the American Heart Association. And I have just viewed you, we have all viewed you as such an extraordinary partner. And this journey of trying to work with consumers and others to know that yes, we're all connected and one begets the other. And thank you deeply for your work in this. And even in our journey a couple weeks ago out to Google together in the food as medicine space. So I'm just really glad you're here and looking forward. I know you're doing a 1-2 punch, and this is, are you first?
So Sarah, thank you very much. It's a pleasure to be here with such an inspiring group of speakers all day and have so many kindred spirits in the audience. As we talked about, the science is just undeniable that what is good for the heart is good for the brain. And as Mitch would say if he was here, and vice versa, because we know with brain health is good heart health. And we first published our definition of brain health as the American Heart Association and the American Stroke Association in 2017. And since then, I've been really looking at how can we get upstream and really focus on those risk factors that are shared between the heart and brain and how we can intervene early to preserve and protect brain health and vascular health, and to reduce the risk of dementia and early cognitive impairment over time. And that's been our focus. And we call this Life's Essential 8, where we look at those health factors and risk factors and how can we intervene early? How do we translate the science into clinical practice, into primary care, and into prevention? And we're so excited that we have been publishing scientific statements on this, and our clinical guidelines are incorporating this as well. And we're also incorporating this in our public policy. Hopefully you're familiar with hopefully you're familiar with our Essential 8, but I would just emphasize, we've been talking about the importance of nutrition. We've been talking about the importance of, and Laurie will talk about physical activity. But I also want to mention that we do see other detrimental impacts on the long-term cognitive health. And that is preserving and protecting young, adolescent, and early adult brains. And we are focused on tobacco use, not just traditional tobacco use, but when we look at the impact of nicotine on the developing brain and make sure that we're intervening early so that individuals have that opportunity for a long, healthy life. But I want to also share something. I have the pleasure of leading our public policy and advocacy work for the American Heart Association. And what I see as such a great potential is how we bring our coalitions and our organizations together to focus on those policy interventions that can have the greatest impact on brain health. And so we've been undertaking a project, next slide. We've been undertaking a project where we have been creating a catalog or an inventory of policy interventions that all of us have individually been identifying and championing. And we're trying to put together an inventory of this and look at where the science and evidence points to as where we can have the greatest impact and where those policy best lies exist. And so we've been kind of developing this over the last 6 months. We have an inventory of 160 policy interventions at the community level. We talked about with our colleagues at the UTMB, the medical branch of Texas, how we can make interventions in Galveston that really promote brain health. But we've been inventorying these policy opportunities that we have individually and collectively to drive change at the community level, at the state level, national level, and as we look at our global partners and looking at brain health plans across the globe. And so we would ask for your help, because we've compiled an initial inventory, but we would love your input. One, to help us identify what other policy levers or policy opportunities we have that we may have missed. And two, what should we start focusing on a deeper investment in looking at the evidence base as we look at policy implementation and evaluation to determine where can we collectively focus our policy attention beyond advocating for awareness, beyond investments, and beyond what we are doing today to look at where we have a uniform policy agenda for the future. I'm going to turn it over to my colleague, Laurie, Dr. Laurie Whitsel.
Thanks, Mark. Thank you so much. So it's been a great project, and this project is been collaborating with Mark and Mitch on this. In policy research, I spent my time translating the science and evidence into impactful public policy solutions. Excited to do this for brain health, and like Mark said, we're really happy to have your input and look forward to staying in touch on this as we move forward. I'm going to also wear another hat where I help lead, because this is about translating science and evidence and then doing it in partnership and collaboration. And so I'm going to talk about how we're doing a similar kind of collaborative on the physical activity side. So it was just before COVID, we helped pull together the physical activity community to unite and speak with one voice on national policy and systems change. I think it's really powerful when you can bring consensus-based solutions to policymakers, and we're trying to do that. The physical activity, I don't think I need to reiterate it here, but it is recognized as one of the most important interventions to address brain health and well-being. And so, we're excited to see the continued emerging evidence around depression, anxiety, early Alzheimer's. The exciting work that you and Ashley is doing with the MotorPack study, he's mapping out at the molecular level the impact that physical activity has on the human body, including the brain, and looking at gender differences in that. It's just really exciting work. And he calls it one of the most potent interventions we can implement for overall health and well-being. Well, the Physical Activity Alliance came together just before COVID, and we merged organizations, we came together. It took a year to build trust and build collaboration, and we have a number of major initiatives. We have a memo of understanding with the Department of Health and Human Services to support the physical activity guidelines for Americans. We house the National Physical Activity Plan across 10 sectors to promote and support implementation of the physical activity guidelines. We have a Congressional Physical Activity Challenge, which we're going to be kicking off here in May, and many other things. A CEO pledge, which we hope many of the CEOs in this room might sign, to just talk about the importance of your commitment and role modeling around physical activity for health and well-being. But I'm going to talk just very briefly about our It's Time to Move initiative. We're working with a number of agencies and other organizations to embed physical activity assessment, prescription, and referral into healthcare delivery, so much like food is medicine. And so we've done a lot in the last few years. We've created an implementation guide that allows this to be integrated into electronic health records. We all need to be assessing the same thing and comparing against the same thing. We've coordinated with CDC to make sure that we're syncing with national surveillance systems. We want people, when you visit your clinician, to be asked about your physical activity levels, just like you should be asked about your healthy eating. And we've completed that implementation guide. We've worked with CMS to have, they've just recently integrated into the physician fee schedule assessment. They're going to pay for assessing physical activity and healthy diet. So that's important. And that starts the conversation. And then we're working with CMMI, the Innovation Center, to bring, we're so excited to see the Elevate model come out, waiting for the RFA to come at the end of February, early March. This is for the first time CMS is being charged with perhaps paying for prevention of chronic disease and brain health, not just treatment. And so they're looking at about 30 different applicants for this. It's going to be really awesome. And we're requiring that both nutrition and physical activity be part of every one of those applications. So we should all be trying to promote, encouraging health systems to apply. We already know a lot of interest in that model. So we're doing that. We're talking on the CMS side about paying for supervised exercise, just like healthy food prescription. I just would ask us all to think about ways that we can all work together on this. The wonderful panel on healthy food retail, right? I mean, how about retail outlets being that everyday destination in a walkable and bikeable community where people are getting to the outlet. So I love for us working together. I love the idea of collaboration. Thank you so much for the opportunity to be here today. Thank you.
Clicker, yes, Ray. Michael, you're up. This is so important, and I'm so glad that you were going back and addressing pediatrics. I think one of the most interesting sessions, even at the UN, was some of the scientists talking about the first 1,000 days of life and back to our food and what mothers have and don't have. And we all think about somebody older when we're thinking about these conversations. And thank you so much for addressing the younger group.
Thank you. Good afternoon, everybody. Mike Anderson, I'm a pediatric intensive care doctor, faculty at GW, and I've been telling folks last week how excited I was to be a part of this convening today. And several people took me aside and said, "You realize you are a pediatrician, right?" This is not a convening that typically gets pediatricians really wrapped up. But I said, no. The last 6 hours or 5 hours of our day have shown that thread. It's about healthy pregnancies and healthy babies and healthy young adults and becoming healthy adults. So having a pediatrician here is absolutely wonderful, and I hope these bridges continue to get built. So thanks very much, and I told my friends I'm still really excited to be here, so I'm right. It's a great time in children's health, and I typically show about 80 slides when I give a talk, so you talk a lot of people who be here for dinner. I trained in the 80s and 90s, and to see the advances, that was very nice. I got 3. Sarah said 3 slides, I'm out. It's an incredible time in children's health. I think about the diseases we have cured, the advances we have made, the scientific discoveries, great notions about children and all the brain development. It's really an incredible time. When I trained, we were trying to figure out what DNA was and what RNA was, and how to think that kids are getting gene therapy to cure rare diseases. Like, we really need to celebrate. It's an incredible time in children's health. And I once again thinking having pediatricians as a part of this, having scientists and researchers as a part of this is really quite important. But it's not all wine and roses. Talk to your favorite neighborhood pediatrician. Talk to your nurse practitioners and your family medicine docs. There's a crisis in children's health. We want to continue to advance the science of pediatrics and taking care of kids. We want these kind of collaborations to be important. But there are a lot of headwinds right now. The notion of disinformation, the notion that we are losing our status as being cured or having cured the nation of measles. There's no such thing as a routine measles outbreak. And think about the children that then suffer encephalitis from measles and what their brain health is going to be long term. So we are in Congress, in DC, at a time where there is great challenges to pediatric care. And once again, I encourage you, just talk to your neighborhood pediatrician to figure out exactly what they're doing. And the families, I worry more about the families than I do about the pediatricians. So much disinformation, so many incoming, so many salvos questioning basic childhood care. It's a really challenging time in children's health. I'm an intensive care doc. I have a very interesting lens of how I think about things. I do a lot of disaster planning for kids, headquartered here in DC, but across the nation. There's also decreasing pediatric capacity. The number of beds in this country that are licensed to take care of children under 18 continues to decrease. The good news is very few children need an inpatient bed in their time, but when they do, they've got to have the right skilled clinicians and nurses and docs and therapists that are there. It's a fiscal decision. Oftentimes hospitals have to figure out, do I keep this 6-bed pediatric ward open, or do I open an orthopedic ward that's going to pay me a lot more? There's unfortunately fiscal underpinnings of these decisions. So across the nation, there's less and less pediatric capacity at a time when there's more headwinds. So I'm an optimist in life. I think it's actually overall good news. And how do we fix it? Well, this is a slide I show when I talk about how regions come together to think about taking care of kids affected by disasters. It's coalitions. This is a particular one around disasters. This is how we continue to make kids' health better. Bringing folks from Pittsburgh, once again, my friends think you buy are at this conference or this convening. This is the logical place for us to be. Because at the end of the day, we all want healthy kids, which then become healthy adults. So honored to be here, look forward to continued partnerships, and I really appreciate your time.
Thank you. Dr. Palumbo. Now I could listen to this man all day long, and I did when he convinced me to help them with some clinical trials. I thought I was joining a board, and the next thing I knew, I was joining. So there is so much that Dr. Palumbo has done, and I think the breadth of the work and the molecules you're working on right now, really exciting. So tell us a little bit about what's happening.
Is this working? Nice. I understand. But I need water.
Perfect.
So, first, I have to say, this is a magnificent room, and I'm surrounded by magnificent people. But I need to give a plug, if anyone in this building is listening, why we have to fund research, why it's important. Personal on closing. I'm an example of why okay, so if the government hadn't paid in a work study program, biophysics, laboratory, would never be able to do any of the things I do now. When I went to medical school, I received grants to do research, help my research career. When I did psychiatry, I had a grant from the NIH as a biological training program scholar.
Maybe to put this closer so everyone can hear you. Yeah, mine seems to be louder. Maybe it's my voice.
I don't look. But I think it's really important that we do invest in young scientists and invest in their careers. The work I'm doing right now, I'm the principal investigator on a Department of Defense grant, looking at the effects of long COVID and how we can maybe treat the fatigue and the cognitive impairment. I'm first generation American. I couldn't have afforded any of this. Right, so working with Sarah, working with all of you, a big part of this is giving back. So let me sort of talk a little bit about why I'm excited about where we are in our research right now, globally, as well as some of the things I'm doing. So let's talk about Alzheimer's for a second. How do we get where we are right now? Right, so John Dwyer, who's not here, but in a session that we had, said, Joe, everybody, we're doing research projects, and 50% of the people at least probably don't have Alzheimer's, but they're still really ill. What do they have? And they have dementia. 15 years ago or so, we probably knew dementia in some ways better, but we made a choice as a scientific community to go for what we thought was a low-hanging fruit. We thought that
They can hear you.
we thought that amyloid was the target. If you went in and figured a way to harvest that from the brain, it has some real wins. And that was a belief for many, many people. But it was very expensive. It required an infrastructure that involved imaging, laboratories, reinvention. And we came away with a win. We were able to slow the progression of the disease. And that's really, really good. It's not a cure, but it's good. What it allows us now to do is to work with people who know the rest of medicine. It allows us to work with people in cardiology. It allows us to work with people in immunology. Because we needed the first wave. We needed the first wave to really bring people back into the fold. You know, if you look at pharma in the last decade, pharma had walked away from neuroscience entirely. Now it's sort of coming back, and a lot of it has to do with these wins, and that's great. The world I live in is one that is related to genetics, immunology, epigenetics, biological and clocks, immunological clocks. Well, the bottom line is it comes down to sort of lifestyle factors. All the things we've been talking about today. And it doesn't start with an intervention at age 79. It starts with an intervention to create safety, interventions to create good nutrition in moms, right? So that's where this thing, I've worked in autism. I helped to develop the first oral therapy to treat some of the symptoms of autism. What we learned is that these are immunological disorders that have physiological changes in the brain that we can measure with EEG, et cetera, but that good maternal health, a safe environment predicts the future. All of these conditions we're talking about today have a particular genetic component, but also an environmental component. I've treated patients in the VA system for years. I'm also board certified in addiction psychiatry. I've treated PTSD, and I've treated folks who have needed to be withdrawn from heroin, et cetera, et cetera, et cetera. The bottom line is that the things that we're talking about doing here today are really important. The one thing I will say that we can make things better, this is to go back to what John Dwyer would have said had he been here, is that how do we do research better? One of the things we've been doing where I'm working now is we've started to reach out directly to patients and families. We're going to their homes, where we've done some of that with you as well, in senior living. I think that's the key. I think it's bringing the research and making the investment of putting professionals on the road, visiting homes, following up. Because I think the model we've got right now doesn't work as well. I mean, it works fairly well at the academic institutions, but I really have my concerns about just how well the system is working for research. So I think that's going to be very, very helpful. I think working with pharmacies, working with food providers, I think that's the way we meet people, right? I think that's where their credibility is. So let me stop there, because I think I've over-talked.
No, it was perfect, Joe, thank you.